The deliveries small at first, then even smaller. Pfizer's shipments stopping entirely as it upgraded its Belgium facility to boost capacity. Now the pharmaceutical giant says the days of small deliveries to Canada are over.
Pfizer is extremely committed to meeting its contractual obligations, and we have every intention of meeting the 4 million commitment by the end of March that the Prime Minister has been talking about.
The head of the company told Rosemary Barton Live starting this week, Pfizer's delivering more than 400,000 doses. It's also agreed to boost deliveries from April to June by an additional 2.8 million doses and add an extra 6.2 million between July and August.
We're going to continue to look for opportunities to accelerate delivery. We recognize that we want to bring as much vaccine to Canadians as soon as possible.
That's on top of the Prime Minister's announcement Friday. Another 4 million additional doses of the Moderna vaccine secured for this summer.
We will share this schedule with provinces and territories so they can prepare to get all those doses into people's arms.
Hopefully the provinces have used their time wisely to boost their infrastructure such that they can rapidly deploy these vaccines into the right arms as quickly as possible. I think most of the provinces have done this.
In anticipation of Pfizer's shipments, Ontario outlined today who would be in the second wave eligible for vaccinations, including people over 80 and all Indigenous adults.
We're going to watch those distribution centres massively scale up.
As vaccinations go up, travel restrictions are too. This week, tighten rules at land borders to help buy time as variants spread across the country.
Those variants, I think, represent a very, very significant risk. We want to make sure that we do everything possible at our borders to slow down the importation of that virus, while our public health, regional public health agencies and provincial agencies right across the country are working tirelessly to get the situation under control.
Actually, we know changes are coming to the land border. What happens tomorrow?
And new restrictions will be in effect. Canadians coming from the U.S. will have to show proof of a negative COVID-19 test, just like at the airport. The government is also now considering regular tests for truckers and others carrying essential goods across the border. And in a week, there will be even tougher measures for air travelers, including something we've been talking a lot about, people having to quarantine at a government-approved hotel and foot the bill, upwards of $2,000.
All right, Ashley, thank you.
Thank you.
Well, let's turn to Dr. Isaac Bogosh, an infectious disease specialist at Toronto General Hospital and a member of the Ontario Vaccine Task Force. Dr. Bogosh, the next phase of mass vaccinations in Ontario goes to people in their 80s and those in Indigenous communities. What's after that?
So basically the end of phase 1 will really dovetail with the start of phase 2, and they'll overlap. And in phase 2, we'll be prioritizing other elder populations in the community, those 65 and up. Prioritization will go to those with medical conditions that might preclude them to having a more severe infection if they were to be infected with COVID-19. And there's a long list of medical conditions that can do that. In addition, there'll be communities that will be prioritized. For example, communities that are disproportionately impacted by the virus. Congregate settings are prioritized, and frontline providers are prioritized, including teachers, first responders, and other essential workers.
So it sounds like a big job. How is it going to actually roll out?
It's really an all-hands-on-deck approach, and the public health units are really making these plans that include mass vaccine sites involving primary care, involving pharmacies, community centers, for example, for communities that might not be as comfortable as trusting of the healthcare system or the government. People feel more comfortable going to their local community center. Mobile trucks as well to help vaccinate, for example, populations that are homeless or underhoused. So really, truly an all-hands-on-deck approach to get priority populations vaccinated.
It'll be interesting to watch. Dr. Bogosh, thank you.
My pleasure.